show you what thermography is. That's a completely normal thermogram, 52-year-old lady, 53 years old, breastfed children, completely normal. Black is cold, then shades of blue, yellow, red, bit of thyroid problem up there, completely normal. There's right-sided breast cancer, stands out like a sore thumb. That lady had completely normal mammograms and ultrasounds. In fact, in the end, I went to the radiologist and I said, if this woman hasn't got breast cancer, I'll sell the camera back to America, $40,000. They got a bit worried and sent her for an MRI, and that picked up the cancer. I want to cover what I'm now involved in, and have been for the past 5 years, because it's yet another extension of how dentistry is involved. This lady, 53 years old, she had breast cancer, 6 root-filled teeth, 4 of them happened to be on the breast acupuncture meridian. So what are her chances of not getting cancer? She also had amalgams and crown and bridge. And that x-ray was passed by a top dentist and oral surgeon as being okay. But hey, even I can see the problems, plus all the metallurgy. Here's another one, breast cancer, 4 root-filled teeth, 13 amalgams and 3 crowns. Huge problem. I get a patient with an abnormal thermogram that's deteriorating. She's heading towards breast cancer, and they've got that in their mouth. What am I supposed to do? Because it's pretty devastating to the patient to think that I'm going to get breast cancer unless I have all this dealt with. At huge, huge cost, psychological as well. But this is where we can combine the two professions. That's a completely normal thermogram. She happened to be one of my staff. All my staff are female for some reason. And when I got the camera, everybody had thermograms done. 2 years later, I suggested we ought to do them again, and we got a nasty surprise in this nurse. She had a very nasty looking right breast, which was typical, in fact, of a DCIS, a disseminated ductal carcinoma. The nipple temperature had gone right up to over 1 degree, 1.3. So we intervened. We instigated measures which consisted of removal of a root-filled tooth, had to be on breast meridian as well. She had her amalgams removed. She went on vitamin C, selenium, DIM, Mullimin, homeopathic. 3 months later, looking better. 6 months later, looking even better. Nipple temperature down to 0.3, so it's normal. So before March it was that, and 1 year later it was that. Basically by including some dentistry and a few other bits and pieces, but the main thing was dentistry. So we've got a tool here with thermal imaging that can make inroads into the commonest form of cancer in women.